This morning, pregnancy and childbirth remain serious risks to women's health, even today in 2018. Can't get used to saying 2018 yet, Dr. Thompson. Tennis superstar Serena Williams recently talking about her own life-threatening health scare and why women really need to be their own health advocates. Dr. Sharon Thompson of Central Phoenix Obstetrics and Gynecology talking about some of the risks in this story that really made news with, you know, a superstar athlete of her caliber, Serena Williams.
Often celebrities teach us about what we're all at risk for, and Serena Williams' story is a good example. Here's a woman who had blood clots before, previous to pregnancy, and so that put her at extremely high risk for developing it again, you know, once she was pregnant. And certainly that is what happened to her. One key lesson in her story is you are your own best advocate. It is so important to know your own health history, be aware of it, and communicate it. Because people may have read the story that she had symptoms and she had to advocate and say, hey, here's what I think is going on.
Okay, so talk to me about kind of what went on with her, at least from what you read, and why that relates to pregnancy or delivery.
So my understanding for her is that she had a condition called pulmonary embolism, where you can get blood clots in your lungs. Typically, they start in your legs, and then they move up through the bloodstream to your lungs. This happened to her prior to getting pregnant. Now, one thing that people don't understand, because pregnancy is usually such a happy time, is that there are a lot of risks. And one of the things that can happen in pregnancy is that clot, the risk, the likelihood that will happen to you is the highest it will ever be
during pregnancy. Oh,
exactly. So what happened with her is she had been on blood thinners, as she should have been, if that was appropriate, but she had to have a C-section. She mentioned that in the article as well, and you have to stop the blood thinners because you can bleed extra when you have a surgery. And because of that brief period where they stopped it, she developed another blood clot. So she knew her own history, she knew she was at risk, and she said to her caregivers, hey, I have symptoms, I think this is what might be going on, so that she could get the appropriate testing and treatment.
And it's kind of incredible because at that moment in time, I imagine you're thinking about the baby only. You're sort of, you know, all caught up in this rapture of the birth of your new baby. But you still need to, and those around you need to be in tune to how your body is feeling. And being able to tap into something not feeling right.
Absolutely. If you don't feel right, if you're worried, speak up. You know, especially if you're in a hospital. A lot of moms will think, I don't want to bother the nurse. Well, that's what she's there for. That's why we don't send you home immediately. So that someone can keep an eye on you. So please be your own best advocate, know your history, and really let someone know what your symptoms are.
And we've got some advice that you shared with us generally for moms to be. Let's talk about some of these points.
I'm going to start with the last one first. Dr. Google is terrible.
But that WebMD doctor, I mean, why do I have to bother with medical school when Google and WebMD are out there?
They're horrible. and they will more scare you than do anything else. So if you have a concerning symptom, please contact your healthcare provider and they can help you sort it out. But don't self-diagnose, because we would rather see you and it be nothing than you stay at home and it's something. So definitely bother your healthcare providers. Follow your doctor's advice. So if your doctor tells you to take a medication every day, please take it, because they're only telling you to do it for your own good. Make sure that you do the things that you can do. Eat well and exercise. Those are huge in staying healthy. I am certain that one of the things that helped Serena Williams, she is in amazing shape.
Incredible. I mean, an incredible athlete, one of the greatest athletes in the world.
And I have to point out, who won a Grand Slam when she was 9 weeks pregnant.
I know. It's unbelievable. Beautiful baby, too. So her story, more in-depth, is in this month's Vogue, and she and her new baby are on the cover. And just remember, take care of yourself.
Take care of yourself.
You can't be a good mom if you're not taking care of your own health.
Absolutely.
Dr. Thompson, great to see you. My first time to see you for 2018, so Happy New Year to you.
Happy New Year.